drawing, schoolwork, and played Ring of Roses about 100 times. We've all been under some strain lately, but let us embrace our children. They're under strain too. Let's show them more love, patience, and care. Let's help to build their resilience in these trying times. Not just today or tomorrow, but for the future. Their future.
A message from the Child Care and Protection Agency, Ministry of Human Services and Social Security, and UNICEF.
Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning in to Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Good day, everyone, and welcome to another segment of Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and today we want to talk about tackling the COVID-19 vaccine hesitancy. It's a topical issue, and our guest is Dr. Arthenesia Hamilton, the Director of Primary Health Care Services at the Ministry of Health. Dr. Hamilton will be joining us virtually, and she will be giving us some time out of her busy schedule to share on how we can get across those roads, what we would call speed bumps, or hindrances towards achieving our immunization target. Dr. Hamilton, good afternoon. Good afternoon, Dr. Hamilton. Oh, there seems to be a technical issue. Are you hearing me, Dr. Hamilton?
Yes, I am. Can you hear me?
Yes. So I just introduced you to our people on Kaieteur Radio, our regular viewers and listeners, to the program Your Health Matters. I believe this is your first time on here, and I know that you are busy and we'll have to wrap up in a shorter than usual time because of your schedule. But just give them a little bit about yourself before we head into the program.
Hi, good afternoon, Ms. Ramsey. Good afternoon, everyone. I'm the Director of Primary Healthcare Services at the Ministry of Health, and under this program is the COVID-19 vaccination as well as the regular vaccination program.
All right. So we are talking about vaccine hesitancy in Guyana, and this is something that is topical. We are experiencing a lot of pushback because people are quite concerned about the safety and efficacy and all of that about of the vaccines, and so. Basically, I do share a bit about what's happening, or if I'm talking about a topic, I try to give a bit of background information. And based on some of my research, when we started rolling out the vaccine campaign in Guyana, UNICEF and the Ministry of Health teamed up and did a study, and it showed that persons since then were quite hesitant. They were like 57.3% of the eligible population who shared their concern over the perceived side effects or adverse effects of the vaccine. The main barriers, based on my research, are past experiences with taking vaccines in general, because some persons have allergic reaction or side effects in just normal taking vaccines, not just the COVID-19 vaccines. The perception of risk, the lack of trust in vaccine programs, beliefs and concerns about, as you know, safety. So as we head into our discussion, I just wanted to ask you, what can we do, or what can the ministry do to try to alleviate some of these concerns? Because I know you've been doing a lot of advertisements, trying to talk to people and so on, but what else do you believe can be done to reach out to these people?
So thank you for the question, and I'm happy that you did some research. And I wanted to add some context to what is it that you spoke about just now.
Mm-hmm.
So based on all of our applications in running any communication campaign for public health, one of the things that we try to do is to ensure that what we're planning for is based on information. And so that is why we went out to engage persons to understand what would have been the challenges with the introduction of this vaccine. You are correct, most persons were hesitant based on what they perceived to be side effects from the vaccine. And we ourselves were able to be educated as to some of the things where persons are actually confused. And one of them that I actually wanted to zoom into would have been previous experiences with vaccines. Now, actually, a lot of what persons would have considered then is that everything that is injected, they consider it to be a vaccine. And so there is a misconception in relation to what is an injection and what is a vaccine. And a lot of those persons who would have answered, they had reactions with injections before. Now, the thing is, a vaccine is totally different to an injection, even though the application into the body is almost the same, in the sense that the vaccine has a biological product and an injection doesn't. Now, we took all of the information that we got from this actual campaign, from the hesitancy survey, and that is what we used to actually roll out our campaign. That is what helped us as to what messages we needed to zoom in on for the general public. So we started off with the general education, as you would be aware, of what is a vaccine. That is how we started off. What is a vaccine? What are the normal side effects of a vaccine? What makes up a vaccine, so that persons are aware. Then we got into the entire topic of the COVID vaccines, which were the main topic at hand. Now, a lot of the hesitancy with this had to do with persons thinking that the vaccines were developed too fast, and so not having enough information from trials to be able to use it on persons. Now, vaccines were developed fast, but you have to understand that they were developed from a platform of what happened before. This isn't the first time vaccines are being developed, and so all of that information that they have from before, you don't have to reinvent the wheel. What you're basically looking at is a different organism, but you don't have to reinvent the wheel as in the process. It works the same. The vaccines work the same. But not just that. These particular vaccines had a lot of funding put in it that was placed on getting them done. In most instances, you have vaccines taking a much longer time because the funding is actually very limited to get it done. Everybody pooled their resources because they recognized that this pandemic was very important. And so manufacturers and scientists had a lot of funds to accelerate the process. Now there was the entire Now, the mRNA vaccines, they were concerned about it because of it was the newest vaccine technology, and persons were being told that because it's an mRNA, it will affect your DNA. Now, what we would have known from before is that even though the vaccines were now made, the mRNA, they were working on this for quite some time, at least 15 years or more. And this came based on the fact that you had the MERS. Now, MERS was probably the next biggest thing to what we have now with SARS. And because they had this happening in more than one country, and they recognized the potential for that becoming a pandemic, work started from that point in time.
And
so when you actually had, probably 15 years ago, they started working on that after you had that outbreak in China and other parts of the world, because they recognized that the disease crossing borders was very, it could have happened with that particular disease that took place at that time. And so work started then. So what they did was to utilize the foundation of that to then transfer it to looking at this disease, since they were both viruses and there were some similarities. And that is why we're at a point in which these vaccines were developed much faster. Now, the thing is, all of the vaccines, before they can be utilized, have to go through trials. And you have to pass your phase 3 trial, which is the last. And then you can go into actually providing utilization on an actual population. Understanding, of course, clearly that the trials require human subjects, because that's the only way you're able to see what would be the effect on the persons when you're using the vaccine.
Mm-hmm. So basically, what you're saying is that these vaccines weren't developed overnight. They are part of a chain of research which came
Ongoing
from
activity, yes.
So it came all the way from when you had SARS, like 15 years ago, when SARS first hit China, and that's the same formula that they're using. So basically, what you're explaining to us, to our viewers, is that the COVID-19 vaccine was developed based on the same components and the same research. So it wasn't just overnight, fly-by-night research that went into this.
It was not fly by night. It was the process. The thing is that they never stopped working at any point in time within the health system, within science. There's never a down period where nothing happens. They're always working on things that, based on information and what happened before, because in a lot of cases you see reemergences. And so you don't wait for a reemergence to then decide on what it is that you're doing next. So there's always work that is going on continuously. And I can tell you, I'll give you an example. In this moment, well, maybe not this moment, 2015, the polio vaccine. Now, one of the things that started happening with the polio vaccine is that they're looking at elimination, but they understand very clearly that even though you may arrive at elimination, you can still have a re-emergence happening somewhere, and that can continue the cycle all over again. So they're continuously working on seeing what is a new vaccine that can be utilized for polio. Before, most of the polio vaccine was oral. Now, the regime that we're giving persons is the injectable inactivated polio vaccine. That is just an example to let you know that they're forever trying to refine the process to make it better. So vaccination studies and what we're putting into vaccines will not they're always going to continue looking at other ways to see how you can make the process better. And there will be new vaccines as new diseases arise, because vaccination is probably the most, what shall I say? It's actually one of the public health interventions that is the most successful, because it prevents diseases. And that came from how many years ago, and it still remains the same. So as
it's
a public health
basically.
body, as a health body, you're always looking at how you can prevent people from becoming sick.
Okay. One of the things that I mentioned earlier is that a lot of people are concerned about side effects. We know there are some short-term side effects, not just for COVID-19 vaccination, but vaccination in general. Could you speak to what is expected and what people can have? Like, say they are going to take the vaccine today, what can they have at hand so that when they take and they should they experience any side effects, what medication they can use to alleviate some of the pain or whatever it is that they will experience, discomfort? And also, if there are any long-term effects known for COVID-19 vaccination.
So thank you again for that question. So the actual side effects that you have from the vaccines, they're the same as what the children in the under 5 population receive when they're getting vaccines. So you can have mild fever, you can have headache, you can have tiredness. Persons complain of headaches, persons complain of joint pain, muscle aches. Some people may have vomiting, some people may have diarrhea. And that is depending on the vaccine that you take. Now, what we suggest for persons is that you continue to hydrate, whether you have symptoms or not. As long as you're going to get your vaccine, ensure that you're hydrated. So you should have enough liquids in your body. Now, we also recommend that if you do have symptoms, the pain, the fever, the paracetamol works very well, or the Panadol. It alleviates those symptoms. Most symptoms that persons receive, the duration is at least for 24 to 48 hours. Some cases you may have 72 hours. Some people complain of symptoms going all the way to a week. But the majority, and I'll say at least 90% of the cases, your symptoms are alleviated before 72 hours. Now, we have had the most severe side effect of any vaccine is called an anaphylactic reaction, which leads to anaphylactic shock. Now, the anaphylactic reaction is the most severe form of an allergic reaction. In most cases, that happens within half an hour, 15 minutes to half an hour of receiving the vaccine. And it is one of the reasons why persons going to take the vaccine, and they're observed for that period of time before we allow them to leave, because this is the most severe form. And so we do have emergency medication at the vaccination sites that if someone exhibits any allergic reaction or anaphylactic reaction, we're able to treat it. And then they're sent to the nearest health facility for observation and continued treatment. Now, we have had cases reported with some of the vaccine of Bell's palsy. Now, Bell's palsy is actually a partial paralysis of the face. And this usually resolves with treatment and therapy. We have not had any case of Bell's palsy in Guyana.
Dr. Hamilton?
4,200. Yes, I'm here.
No, I lost you a bit there. So we haven't had any cases of those here.
We haven't had any case of Bell's palsy in Guyana.
What is the most serious case, like in terms of taking the vaccine? Because I haven't heard of any, but just for our listening public, what is the most severe reaction to taking the COVID-19 vaccine that has come to your attention so far?
Well, we have had persons who have had allergic reactions to the vaccine. But we have the advantage that we're able to capture those persons at the actual site, most of them. There are people who went home and had adverse reactions. But most of the cases, we were able to manage them just on site. There are persons who complained of fever. Some people had to go to the hospital because their fever took a while before it resolved, and some people had headaches that went on for at least the 48 hours. So we would have recommended that they go to the facilities for that.
But all of these things are normal and they're treatable.
Yes, they are. Within the context of Guyana, all that we would have seen are normal and treatable. And they fall within the range of the side effects of vaccine.
And for those persons who would say, okay, you want us to take the vaccine and all these things can happen to us, what would you say to them, weighing the benefits against the risk of not taking the vaccine?
Well, actually, the thing is that these side effects are actually your body's way of building its immunity. And it's how the body is actually working to then have a memory and to have an immunity built against this particular virus. So that if you do have a future encounter, the body already knows how to fight it. Now, that particular point is what takes me into the benefits. Now, everyone is saying that what is the point of taking the vaccine if you can still become infected? Now, that's a valid question, yes. But you have to determine how you want to face the virus. Do you want to face the virus with an army, or do you want to face the virus alone if you do become infected? And what do I mean by that? Facing the virus alone is the person who is unvaccinated. And the virus, if you're vaccinated, it means that you have an army to go against the virus with. And so the chance exists that you can actually fight and win the battle. Some persons may become infected, but the good thing about it is that even if you become infected, you will not develop the most severe form of the vaccine, which causes hospitalization.
The virus.
Within the context of Guyana, yes. Within the context of Guyana, we have had a very, very small amount of persons who would have become infected with the vaccine, and I can say to you now, none of those persons were hospitalized. None. They had the mildest form of the disease, and in most cases, persons only recognized that they were positive because their partner or family member who was unvaccinated, or whoever they were in contact that was unvaccinated, and they went to do the routine screening because they were in contact. So most of the persons were asymptomatic.
So basically,
but that is just to give you the information that within the context of Guyana, vaccines are working.
Yes, and we have we're trying to get all the questions in, but we have a notion of people saying, okay, all right, there are short-term side effects. What about long-term? What about like 2-3 years down the road I develop something because of the vaccine? What do you say to those persons? How can they trust your word as a health professional? Would you recommend them going to do their own research in terms of getting to know what they're putting into their bodies? Because I know the internet is a really good source of information.
Information is always very important for decision making, and going and do your own research is very important because it gives you the opportunity to be informed so that you know what is the decision that you're making. But the challenge that we actually have right now is that there are lots of sources of information, and a lot of those sources of information, they're not authentic. So persons are capitalizing on an opportunity to give people false information, recognizing that they're in a vulnerable position. Now, I'm speaking as a health worker. I've been serving the population at least for 11 years already. And most of my colleagues, the same thing, even more and some less. Now, we have been giving you the service the same way, understanding that our main role is not to cause any harm, but to ensure that we give you the best. That is the same approach that we're taking with the COVID-19 vaccine. And I think we should be able to run from our track record. We have been vaccinating for over 40 years in this country. And we have not caused harm to people for over 40 years. We have been dispensing medication and looking at sick persons for older than you are.
True.
And we have not done so with any harm. And so I think that should be the platform to which persons recognize that the vaccination program is just a way of trying to protect you. We recognize the danger. We have a deeper understanding of what is happening, and it's just a case of trying to prevent you from having to deal with something that could be avoided. These things can be avoided. Death by COVID-19 can be avoided.
Yeah. In terms of spotting, let's say I want to go online and do my research. Is there any way that I can know which website is, what can I say, authentic and trusted? Are there ways of finding these trusted source of information?
I would suggest that if you're going into any website, go to a Ministry of Health website. Go to Ministry of Health, Guyana, Jamaica, Canada, the US, CDC. Go to those websites. That's where you're going to have the information that is correct. Go to the WHO, go to UNICEF, go to PAHO. Every other person that pops up, they're always going to tell you, and I'm one of the persons that looks at this because people ask me all the time. In most cases, you see clips with information coming. But when you go to behind and you get the entire conversation, they just take out a particular clip that says something that serves the purpose that they're trying to perpetuate. And the entire interview says something differently. The context is totally different. And that is what is being used in a lot of these social media information articles on COVID-19. They're just looking at just a clip, 2 paragraphs, and the entire context of what is being said is totally disregarded, and you're just using one part of it to propel an entire story on the virus, on the disease, on the vaccine. And so if you want, even if you're going to take that clip or a piece of information, there's usually, if you take that out and you put it in your cursor for Google, they can bring up the entire story. And so you do have an opportunity to get the real story out of the clips.
I have some specific questions here. about persons who are concerned about the vaccine, if it will affect their fertility. Remember, I asked you earlier about long-term risk. If it would affect their rate of their fertility. Persons who are pregnant or nursing, which COVID-19 vaccine is suitable for them. Stuff like that. But we're running out of time here because I know you have another engagement. But can you just give us a rundown of who is eligible and who is not eligible for the vaccine? Because generally we know that persons 18 years and over can take the vaccine. The vaccine is open to them, but there are some persons who are still saying, okay, I'm pregnant or I'm nursing and I don't want to bring any complications to my unborn child or my baby. What would you say to those persons? What would you recommend?
So in relation to some of the misconceptions, the vaccines do not cause infertility.
Mm-hmm.
They do not cause impotence.
Mm-hmm.
And so women and men of sexual reproductive age who are still sexually active that would like to still have a family, you can go ahead and take your vaccines. You're quite safe. Mm-hmm. Persons who've gotten their vaccines have become pregnant. Persons who've gotten their vaccines have given birth to very healthy babies.
Mm.
It's an opportunity for you to protect yourself, and there's additional benefit of protecting your unborn baby as well because you do not become infected, right? In relation to everyone being eligible for the vaccine, there are some instances in which we will delay giving the vaccine, but it's not that you will not receive the vaccine at all.
Mm.
So some persons will require some amount of clearance from their physician, or the actual process will be done as a co-management. Now, we have some specific cases, like persons who have hemophilia. We want to have those persons, the vaccination activity, be co-managed with their attending physician. If you would have had an acute cardiac arrest, which means that you have had a heart attack, those cases, we will prolong the vaccination to a later date when you are fully recovered.
Mm.
Persons who've had COVID-19 that are wondering if they can get the vaccine, you can get it as soon as you recover. We have cases like persons who are epileptic, persons who have sickle cell. They're eligible for the vaccine, but what we try to do is ascertain when they had their last episode, ensure that they're on their treatment, ensure that they're hydrated and all of that before they get their vaccine, because if they are to develop fever as a side effect, those can trigger as a episode. So that's why we ensure that those persons, they're on their medication and they're in a good position and they receive their vaccine.
Mm.
Pregnant women and lactating women, you can have your vaccine. There's no risk for you receiving the vaccine.
Okay, so just before we go, there are questions. This is not really on the topic of vaccine hesitancy. The persons who are on the waiting list for the Sputnik V dose 2, what can you say to encourage them? Because I know that some of them have passed the 90 days period. I think it's 90 days, yes. For them to receive their second dose. What can you say to quell their concerns in terms of, I know that this is not really, you don't know when it will arrive, but you know that there's a time period, and you know that it's time sensitive and people are concerned. So what would you do what would you tell them to help to quell their concerns?
So we will be expecting a shipment very shortly. I think what would have been indicated to persons is that there is a challenge on the international market with receiving this particular vaccine, and not just within Guyana, but all of the other persons who are utilizing the vaccine. The situation is the same. The demand is higher than the manufacturer is able to produce, and so they're trying to produce as fast as they can. And
Dr. Hampton?
I'm here.
Yeah,
so that there's still equitable distribution, yes, across, so that everyone still gets their amount. So that's why we will be getting amounts on a regular basis, but not the large amount. For the persons who are close to 90 days or above 90 days, we still have the process in which we are ensuring that as soon as the shipment gets there, that we have those persons vaccinated first. We were hoping to have everyone in April come forward in April to get their vaccines, but apparently some persons were a little later. But as soon as we have our next shipment, we'll be considering the persons in April and May to finish off those batch before we go on to the other month, and the persons who still have some amount of time before the 90 days has arrived.
So it's you still have persons from April, you're saying?
Well, I wouldn't be able to say, but the only persons who would have gotten to 90 days by now were persons who would have received their vaccines in April. So if those persons are still there, we will still make the special arrangement in place for them to receive their vaccines first.
Okay. So I know you have an engagement now. So I just want to thank you for sharing with us here on Kaieteur Radio. For those who've listened, I hope that you've garnered some information that will help you across that hesitancy bump. I've gotten my first dose. I'm waiting my second dose, and it has been an experience. It wasn't. I didn't have the side effects, a lot of side effects, just a mild headache. And I would encourage you to take your vaccine, because I know that Guyana is pushing for herd immunity, which is getting everybody vaccinated and getting your body at a state where you can fight off the disease, the infection, should you become infected with COVID-19. So, Dr. Hamilton, thank you for joining us. Those who join us every week, well, we weren't here last week because we had I think it was emancipation. For those who join us regularly, I just want to say thank you for listening. On behalf of the Kaieteur Radio team, do enjoy the rest of your day and be safe, wear your mask, practice social distancing, and follow the guidelines. And please do, once you can get vaccinated, please do go and get your vaccines. Goodbye.